All right, we're going to move on here. This one's a two-part question. So, Leah, I'll give you the both, and then you can sort of address them both as you'd like to. How is trauma connected to PTSD and depression? What might caregivers observe related to their loved one's experience with trauma?
Okay. Um, well, trauma is the event, right? So it's like the car accident, the prolonged emotional abuse, where PTSD and depression, they're the mental illnesses that can develop after a traumatic event. Um, so with trauma, some of the symptoms can include like emotional numbness, flashbacks, nightmares, difficulty concentrating. Um, but with PTSD, you can have those, but those symptoms can include like hypervigilance, avoidance, changes in thinking and mood. The With the symptoms from trauma, they can last, a short period of time, like 2 weeks maybe after any event. So, a few days, a few weeks, let's say after a car accident that, it might be you might feel kind of goofy driving on a highway, right? And you're feeling kind of goofy or you're a little bit hyper vigilant. But then that kind of goes away after a few days, a few weeks. It would be considered PTSD if, it was 3 months or longer that you're having these symptoms and that you're maybe shaking or having panic attacks whenever you're trying to drive. So, um, trauma symptoms are short lasting, where PTSD and then the depression symptoms can be chronic.
Okay, that makes a lot of sense. Jennifer, how about from your perspective?
Yeah, just to echo again what Leah said. So trauma is that biological stressor, right? And so what I study is a trauma really rewires and changes the brain. All those systems I had just mentioned, involving emotion and memory. So what's very interesting though is that not everybody exposed to a trauma they won't develop PTSD or depression, but those who do, their caregivers might notice really persistent and long-term changes, as Leah had mentioned, in mood, startle responses, attention, and caregivers may notice that their loved ones may react very, very strongly to specific cues related to the trauma, socially withdrawing, really seeming to be stuck in these negative emotional states that, again, last longer than just a few days. I think it takes 30 days to be diagnosed with PTSD. But I think it's very difficult to distinguish between PTSD and depression behaviorally. So it's important to see someone like Leah or, a psychologist or a therapist that because I keep reiterating this, but the symptoms are so similar and they could be co-occurring, depression and PTSD. So really just seeing any of these symptoms, it's so important to see a professional.